Hi. This is Oski with OE again. So today we are going to do nasopharyngeal suction. Alright, so let's assume that all checks have been done. This is my patient. So I'm going to perform hand hygiene according to WHO standard. There's more ample amount of hand gel. So palm to palm over dorsum, and vice versa. Fingers interlaced, fingers interlocked. Tongue rotating, fingertip rotating. I do it for 30 seconds. Allow my hands to drive for 30 seconds. I assume my testing has passed and I'm happy to approach my patient. So hello, I'm Abuna. One of the nurses assigned to take care of you today. How do you want me to call you? Alex. Okay, Alex, I'm here to perform a nasopharyngeal suction. This is to clear any secretions at the back of your throat and your nostril. And also this is going to help you breathe properly when it's done rightly. Is that okay with you? Are you happy for me to do this procedure? Alright, so before we go on, I'd like to inform you that I would like you to sit in a semi-upright position with your head pillow supported at the back of your head to prevent your head from tilting forwards and backwards. I also want to check the patency of your nostril. Can you block one part of your nose and sniff through the other one? I can hear it is patent. The other side. Alright, so I can confirm my patent nostril is patent, so I'm happy to use it. Okay, so I'm going to give you a few instructions as well. I'm going to, if this procedure is going to be a bit uncomfortable and painful, okay, so if it feels so uncomfortable and so painful, you want me to stop, can you do so by raising your hand? The next thing I'll be doing is I'm going to monitor your condition throughout this procedure. I'll be monitoring your heart rate, your respiratory, your breathing pattern, your heart rate, evidence of trauma, any distress, okay, any evidence of trauma. I'll be using the pre-suction baseline observation as a guideline. Also, when I'm suctioning and I feel any resistance or there's any uncontrolled coughing, I'm going to withdraw the catheter 1 centimeters before applying the suction. Is that okay with you? Alright, thank you very much. I'm going to prepare the equipment and get back to you. In case you need anything, just use the call bell, alright? Okay, so I can confirm my tray and trolley is clean and ready for use. Can you confirm that it's been clean for the past 24 hours? Okay, so I have my apron and my gloves here, which is clean and intact. I have my suctioning here, which is intact. It's size 10 fresh. Expiry date is 10 month 2028. I have my goggles, which is intact, and my mask, which is also intact. Then my gauze, which is intact. Expiry date is 10 March 2026. So I'm happy to proceed. Since everything is intact, I'm going to approach my patient. I have my sterile water here, which is clean and intact. Examiner, can you confirm that it is clean? So I perform hand hygiene according to the video standard. According to the video standard, I approach my patient. Perform hand hygiene. So hello Alex, I'm back to start the procedure. Are you happy for me to do it? Okay, so I'm going to let's assume my patient is in a semi-upright position with the pillow supported at the back of the head to prevent the head from tilting backwards and forwards. I've already checked the patency of the nostril, so I'm happy to proceed. So I'm going to wear my PPEs. I'll wear your apron first. Followed by your mask, goggles, then your gloves, so I'm going to connect the catheter tube into the suctioning machine. I don't have one here, so I'm going to improvise and use this. Okay. So I'm going to check where my suctioning machine is working. So I'm going to set it either at 12 to 20 kilopascal or 100 to 150 millimeters per mercury. So I'm going to connect my catheter tube into the suctioning machine. Okay, so I'm going to check whether it's working. So I'll set it 12 to 20 kilopascal. So to check whether it's working, you need to press on the valve. Okay, there's a valve here. You need to press on it before it can suction. So as long as I can confirm that my suctioning machine is working, so I'm happy to proceed. So I'm going to lubricate the tip of the catheter about 15 to 20 centimeters. So I'll lubricate it. So I have my water here, my sterile water here. I'm going to lubricate the tip. Okay. And I'm going to insert the catheter through your nostril. Please inhale as I insert it. Is that okay? Examine if I feel any resistance or there's uncontrolled coughing, I'm going to withdraw the catheter 1 centimeters before applying the suction. Okay. Okay, so I'm going to insert it. Okay. So are you happy for me to proceed? So which nostril would you want me to use? The right nostril. Alright, so I'm going to use the right nostril. So I'm going to insert it. Inhale. 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 Examine, since my patient is coughing, I'm going to withdraw the catheter 1 centimeters before applying it. So let's say I've withdrawn 1 centimeter. So I'm going to be suctioning. Make sure that I use the intermittent suction. That's the 10-second intervals. And I'm also going to rotate the catheter as I remove it to prevent any nerve damage or damage to the nostrils. Okay, good. Alright, so I'm going to start suctioning. So I'll press the valve whilst rotating, pressing the valve whilst rotating, pressing the valve whilst rotating. So it comes out, then you flush it with the sterile water you have down here. Okay, good. So Alex, I'm supposed to repeat this procedure about maximum of 2 times or maximum of 3 times. Would you want me to do the next one? Yes. Okay. So I'm going to use the right nostril again. That's what my patient prefers. So I'm going to insert it through your nostril. If I feel any resistance or uncontrolled coughing, I'll withdraw 1 centimeter. So I'm going to inhale, 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 inhale. Okay, there's not one. I can feel a resistance that my patient has cough. So I'm going to withdraw 1 centimeter. So I'm going to apply the suctioning. Whilst rotating, then I'll be pressing the valve. Whilst rotating, I'm pressing the valve till it comes out. Then I'll flush it. Okay, Alex, I'm supposed to do a maximum of 3 times. Would you want me to do the 3rd one? No, you're okay with it? Alright. So thank you very much for your cooperation. So I'm going to clean the patient around the patient nostrils. And drop it in the clinical waste. Okay, Alex, we are finally done. Are you comfortable? Are you okay? You alright? Alright, thank you very much for your cooperation. So I'm finally done. I'm going to take my leave. In case you need anything, just use the call bell, alright? Examine now, discard all used items into the clinical waste. And discard all PPEs according to manufacturer's guidelines. So I've taken the gloves off. The next thing you'll be taking off is the goggles, then the mask. You drop it into the clinical waste, then your gloves, also drop that into the clinical waste. Ensure my tray and trolley is clean and ready for the next use. Perform my last hand according to the WHO standard. Palm to palm, palm over dorsum and vice versa. Fingers interlaced, fingers interlocked. Thumb rotating, fingertip rotating. I did it for 30 seconds, allow my hands to dry for 30 seconds. And I assume my testing has when I'm happy to end my station. Alright, so bye. Hope you enjoyed it.